Dr. Toni Engram, welcome to the podcast. We're going to have a great conversation. You know what? I think normally people will tell me they love my accent because I'm from Dublin, Ireland. I didn't mention that to you already, but you probably picked up on it. But I love the Texas accent. Like, it's just
No
so
way.
awesome. Yeah. So now the compliments on the other foot, as they say.
Um, and my ancestors clearly are from Ireland. So I love the Irish accent. I think it's amazing.
At, at this rate, I swear everybody's ancestors are from Ireland. It's just what everybody says.
That's true.
We're going to have a great conversation about biological dentistry and oral health and all the things connected there in regards to our health, especially as we get older and we transition through midlife and whatever we can fit in this hour, we're hopefully going to fit in.
Love it. I'm excited to be here.
So, before we get in, as is customary with all podcasts, I think, tell us a little bit about you. How did you get into biological dentistry, which seems to be on the up and up right now? It's getting a bit more popular.
I love that it's getting more popular, and I love that that awareness is spreading quickly, which I think is a fantastic thing. So I got into it sort of by accident. It was definitely not my intention to do biological dentistry. I didn't know what that was when I was going through dental school. Um, but I just really wanted a normal a normal career, a normal dental practice. But around 2011, I got super sick. I was working full time as an associate dentist, and I was opening my own practice from scratch, and was just really working too hard and not taking the breaks that I needed to take, and was too type A to know that my body couldn't do that for forever. So I started having all of these digestive issues, was having to call in sick more and more from work. It really was not having a good time. And I was finally diagnosed after a little bit of gaslighting. I was diagnosed with Crohn's disease and was given a very typical Western medicine answer of, here are your list of medications that you're going to need to take. You're going to be on these medications until they stop working. And then, oh, yeah, sorry, by the way, you're probably going to need surgery at some point to remove all or part of your colon. And I just did not buy that answer. I wanted to know, how do I actually get, quote unquote, get rid of Crohn's disease? How do I actually heal my gut from what's going on? And they just didn't have good answers for me. I even asked about diet, and the gastroenterologist that I was seeing, he looked at me and he said, Toni, your diet has nothing to do with this. So I knew that that was not right. So I had to, like many of us, I had to become my own physician, had to become my own doctor and try to get to the root cause of what was going on myself. And thankfully I did. I found things that worked for me, was able to start feeling better. Was very fortunate, and the medications did put me in remission pretty quickly.
Mhm.
I'm so thankful that we had the medications and I was able to do that. But as I was learning how to heal and getting my gut back to where it needed to be, I found that there were some really key correlations between the Crohn's disease that I was dealing with and the tooth decay and gum disease that I was treating in my practice every day. And really at the heart of it all, there are all these chronic inflammatory illnesses caused in part by a dysbiosis, by an imbalance in the bacteria.
Mhm.
And our mouth is just the top part of our gut. So
Yeah.
if I could learn how to heal my own gut, then really it was my responsibility to be able to heal the mouth, help my patients heal the mouth, heal their mouths from the chronic oral illnesses that they were suffering from.
Mhm.
And so little by little, I started shifting my practice. My patients really encouraged me along the way as well to start looking at prevention instead of just intervention, to look at nutrition and how that can be used in our favor, to be much more intentional with the products and the materials that we use to treat the normal dental illnesses that we treat every day. Um, and so that's really what we sought to do, and to can eliminate some of these toxins in a way that's safer.
A few points here. I do think you're correct. As practitioners, if we have this knowledge that we were able to use on ourselves and effectively heal some issue, then we do have a duty. We have an obligation to share it with other people. The
Absolutely.
second thing is, uh, I can relate to what you said when I got my diverticulosis diagnosis. There was like shock horror. Oh my God, do you know how bad this is? This might end up in losing some of your colon. And I'm like, absolutely not. That is not going to happen. Like, that's not even an option. And I just walked away. That's the end of that conversation. Like, you're definitely, because there's a lot of fear mongering there.
Yes.
Like, this is the end of the world. There's nothing you can do about it. You have to be on these medications. And well, of course, I'm super stubborn. So I was like, no, absolutely not. That's not even an option. And then one of the reasons I wanted to have this conversation is because although it's growing, there is still not a lot of talk around oral health and overall health. And when it comes to oral health, I mean, we say it all the time. We have a lot more we can do about our health ourselves. Like, we can do a lot. But that also goes for your oral health as well. You can do a lot more to optimize your oral health than you realize.
Absolutely. There's a ton that you can do, and that hopefully doesn't involve a ton of intervention from a dentist.
So it's always funny. People say, I hate going to the dentist, and they do. I thought for a while I was just hearing something through the grapevine. Like, do people really say that? But now people actually do say it to me. And I'm like, I don't mind. Honestly, it's like an hour where I get to relax and do nothing. Like, it doesn't faze me at all.
Yeah, it's definitely, two ends of the spectrum for sure. But there are a lot of people where a dental visit stirs up some trauma, stirs up some bad memories, some bad experiences, and it's just very personal. I mean, I have to get literally in your face
Well, I can
in
list some
which
other things
area.
that are way more personal that we have to go through, but
You would think, yeah, yeah.
so before we kind of get into like a few of the topics I want to cover, for anyone that doesn't know, what is biological dentistry?
Yeah. So there is a ton of overlap with different terms. So you can say holistic dentist. A lot of people will say functional dentist, making the comparison to functional medicine, which I think is really good.
Mm.
But biological dentist is going back to those foundations of biological medicine. And really, that is taking our care from being germ focused, you're going beyond the germ theory of disease, which says one germ causes one illness. And so, therefore, one chemical or medication or drug can therefore cure one illness.
Mm.
Going beyond that to supporting the entire terrain. It's the terrain theory of illness. And you'll hear a lot of times this referred to as sort of your toxic load or your toxic bucket. So, what are we doing as practitioners to support the health of the terrain, to decrease your toxic bucket? Or what are we doing that's contributing to illness in the entire body? What are we doing that's adding more to that toxic bucket?
Mhm.
And in dentistry, man, we really can do either. We can help unload the toxic burden by, removing infections that are hidden, removing some of these sources of chronic illness. But unfortunately, the way that we were taught to restore the structure of teeth and restore the function of teeth sometimes means using materials that aren't doing our bodies any favors. They're adding to that toxic burden. So when we're talking about, you know, maybe root canals that didn't heal properly, extraction sites that didn't heal properly, or using materials that are not helpful to human health, like mercury and fluoride and things that are known to be neurotoxic at certain levels. Really, dentistry can do either. We can help, or we frankly cannot help.
Yeah. So biological is more looking in depth at what else is going on, not just the surface, whereas conventional, it's a little bit more superficial, kind of in out. You had a term, fill something, something.
Drill, fill, and bill.
Yeah, that's exactly it. It's like in out next, but I suppose that's very like conventional medicine overall now. It's just in out
Yeah.
next, which is unfortunate.
Just
Whenever
like a
I
surgeon, dentistry is really, really good at restoring the structure and function of teeth. They're excellent at it, and a lot of advances have been made. It's just, just like surgery, we've gotten good at patching people up without being able to go upstream and see what caused it to begin with.
and then prevent it from getting worse in the future.
Right, right.
When it, whenever I think of oral health, there's one kind of reference that always sticks to me, it sticks in my mind, is the connection between oral health and cardiovascular disease. And then that brings me to the other kind of research around cardiovascular disease being the number one killer of women.
Yeah.
Can you speak on that a little bit?
Oh, absolutely. And it was a study called the PESI study. PESI was one of the authors of the study that completely changed my career. And in this study, they looked at, I believe it was in 2014-ish in the journal circulation, the Journal of the American Heart Association. And they looked at 100 patients who were having a heart attack. They were in the hospital doing intervention for a heart attack, and they isolated the clots in the coronary arteries that were causing these heart attacks. And it was shocking enough that in, I want to say it was 30% of the clots or more, they found bacteria that are gum disease causing bacteria in these clots in the coronary arteries. But what was even more insane was that in 78% of the clots, they found tooth infection or endodontic bacteria. So the tooth infections themselves were contributing to these inflammatory clots that got thrown off and were literally causing people heart attacks. So I think, even knowing all of those things, um, knowing all of the studies that are out there, it was just such a huge shock to the system, and I couldn't go back and practice the same way again after that.
Mhm. So that
That
research
research.
showed that basically poor oral health can be connected to higher likelihood of stroke or cardiovascular disease. It's not there's potential correlation or anything, there is direct connection.
Yes, direct connection.
What other research have you seen either connecting or correlating oral health to specific diseases?
It is really just so vast at this point. Any kind of autoimmune condition is impacted by oral health. Um, pregnancy, fertility, pregnancy outcomes, those are drastically impacted by very specific strains of bacteria that are found in the mouth. And so that, I'm encouraging all of my patients, if we can really normalize pre-conception oral care, so that we can catch these things ahead of time and hopefully prevent these recurrent miscarriages, recurrent late-term miscarriages, low birth weight babies, things of that nature. I think that would be just a huge step in the right direction. Different cancers are related to oral health concerns. Really, the list is extensive. Any kind of inflammatory chronic illness is connected to worsening oral health.
So with the fertility issues, is it that it's directly influencing the inflammatory response and thus the stress and immune response? Or is there something else that's directly impacting, say, progesterone?
Yeah, so the bacterial strains that are pathogenic, that are contributing to inflammation in the gum tissue, that we know if it's in the gum tissue, if it's in the mouth, then it's such a direct connection to the rest of our circulatory system that that same bacteria is going to cause the same type of inflammatory response everywhere else in the body, including where it's most important at the moment, which is going to be in the uterus and the reproductive tract. Um, and so it's primarily inflammatory based.
So for those ladies out there who are having issues with fertility treatments or getting pregnant and have been told this might be immune or autoimmune related, it would be a good idea to have their oral health reassessed. Especially, I would suppose, a few weeks before doing another fertility intervention just to stack
Yeah.
conditions in your favor.
100%. I think it's anyone who's trying to get pregnant, I think it's a fantastic idea to get a saliva test done so that we can look at the different bacteria that's in there, see what the risk level is, because there are things that we can do. Sometimes we can make shifts in the oral microbiome within just a few weeks. So it doesn't necessarily have to take a really long time. We just need to know what's in there so that we can be proactive.
It's probably the last thing people think of when they think of fertility would be,
Yeah,
let's look at the opposite end of the body.
right?
That's super
Yeah.
helpful. So one thing you mentioned there, the inflammation is in the gums. What I will say to my clients, because they will just tell me in a very layman kind of way, my teeth are hurting. And I'm saying, if your teeth are hurting, that means the inflammation is now in your gums and it's pressing the nerves. That then tells us that that inflammation is now systemic. It's not just like it's one thing if you've got some aches and pains in your hand, it can be more isolated. But to me, I've always recognized that if you're feeling it anywhere in the cranium at all, at that stage, that inflammation is already systemic.
Completely agree. Yes.
So, well, I did want to discuss the bacteria in the mouth and the inflammation, but you've already covered that. Before we kind of move on, back to what we were saying that we both have gut issues, and honestly, who doesn't nowadays? Like, who doesn't have some sort of a gut issue?
Yeah.
And you mentioned that basically the start or the beginning of our gut is our mouth. And some people would argue our nasal cavity, but regardless, if we can, and vice versa, if we can make our mouth healthier, then it would make sense that we would make the gut healthier, and vice versa. Am I correct?
Yeah, you are absolutely correct. And there are different acidity levels between the mouth versus the esophagus, the small intestine, the stomach, etc. But there are still a lot of overlap in the strains of bacteria that are present. And so we can see markers in the mouth for bacteria that are typically present with people who have gut issues, who have a gut imbalance. And so we sure can. I think it's always good to work with a practitioner who's testing things appropriately, but absolutely we are able to see some warning signs if there are some gut issues that need to be addressed.
For sure. So one thing I reference back to a lot with my clients and my understanding of oral health is minute compared to yours. But when I look at like the Chinese medicine tongue map and try to connect like geographical tongue, mouth ulcers, canker sores, all of that, trying to find the connection. Okay, is there something happening with your gut right now? Like for sure, I know for me, if I'm having a diverticulosis flare, even a small one at the very back of my tongue, I will develop the little lumps. And to me, that reflects the pockets inflamed in my large colon. And then
Yeah.
what have we people who maybe go on a binge weekend and they will get canker sores along the side of their tongue. That usually indicates your liver needs a little bit of help there. But that's something I found really helpful in my practice just to help support the different systems of the body. But
Yes.
one thing you mentioned, and I have to bring this up, probably be doing a disservice to my followers if I didn't. A lot of controversy here in Calgary and Airdrie and surrounding areas recently over the re-addition of fluoride into the water. So, like a huge uproar. It had not been in the water for donkey's years. Now they're trying to get an injunction to stop it. It was already re-added back in at the end of June, which in my opinion, is scandalous and ridiculous at the same time. Like the argument is not solid, in my opinion. Like it's going to prevent cavities, pretty much is the argument. Like it's their only argument.
Yeah.
And I'm like, well, if you care so much about cavities, then why aren't you providing these people with fluoride themselves? Or like, there's the argument is null and void.
Right.
But you mentioned, or at least picked up, that maybe you're not a fan of fluoride either.
You are correct. And I'm definitely not a fan of fluoride in our water supply because, just like you said, you really cannot control the dose for individual people. And if you can't control the dose, then how can we ethically give a medical treatment to people who are not consenting? Yeah, I was taught in dental school that medication without consent was kind of a no-no. Um, but apparently it's okay for our water suppliers to do so. So yes, I have huge problems with water fluoridation just from an ethical standpoint. Not only can we not control the dose, no one is consenting to it. The only benefit is the potential tooth health benefit, the potential reduction in cavities. And I would argue that the benefits of that are not what they once told us they were. You can look at different countries, different areas of the world, those who fluoridated their water, starting in the 1940s and 50s, and those who didn't. And you'll notice that the rates of tooth decay decreased the same in fluoridated areas and non-fluoridated areas. So I really don't think that fluoride in our water was the key to lowering the rate of tooth decay in the world. It really was like everything else, like all the other communicable illnesses. It was better hygiene and better nutrition and lifestyle practices that led to that decrease. So if it's not that effective, we don't have consent, we don't control the dose. Well, is there, some of my colleagues would argue that, oh, what does it hurt? We're just helping people. Well, now there's some pretty clear evidence that it actually does hurt.
Mhm.
There's some pretty clear evidence, even studies sponsored by the US government, the National Toxicology Program, found that you really can't determine what a safe level of fluoride is in our water. So if you go back and you look at some of these studies, they're correlating increased levels of fluoride with a decrease in IQ for our kids. That that's just not acceptable to me, and I don't understand why it's acceptable to any of my colleagues. So yes, I have loads of issues with water fluoridation. I'm excited for the two states in the US that have decided that they're going to stop it at a statewide level, but we have much work to do. Clearly in Canada too, much work to do.
Is there fluoride where you are?
There is, yes.
It's bizarre because we didn't have it for so long. Like, and it's only Calgary and then people on the water line for Calgary. So then the further out you go, then there's no fluoride. It's just bizarre. I'm even
Fascinating.
starting, yeah, I'm even starting to wonder now if the people who make the reverse osmosis systems had something to do with it, because now they're making a killing. But with the argument, like, so the negatives, we have a doctor here called Dr. Bob Dixon, and he's kind of been one of the louder voices in fighting to keep fluoride out of the water. And he has been up in front of several committees in the States as well, and he's trying his best, but they're not listening. It's not that he doesn't have the numbers to support him, it's just they don't want to listen. Like you mentioned, we know it's a neurotoxin. It can accumulate in the pineal gland, it can affect the thyroid, it can affect bone health, and it's not just the cavities that need to be considered. And I think we would both agree that if Calgary City or all of these different city managements and councillors really cared about cavities, maybe they would subsidize dental health and care more. Maybe they would be handing out toothbrushes, toothpastes, mouthwash in schools. Maybe they would be subsidizing better foods for children, because it's my understanding it's also the lower class kids that are affected more because maybe their nutrition isn't as good as the higher class kids. And there's a whole argument to be made. I don't think you can just say it's good for your teeth. Well, if you really cared, I think there's better avenues we could go down.
Absolutely. And I've never bought into the argument of it's basically government entities saying poor people aren't smart enough to prevent these illnesses on their own. So therefore, we're going to blanket them with these protective measures.
Mhm.
That's essentially what they're saying without saying it.
Yeah.
And I hate that. I hate it. Um, because I think our job as practitioners is to give people the tools to live their best life, give people the tools to have their bodies do what they're meant to do on their own, and give people the tools to be able to feed their family well,
Mhm.
and the rest takes care of itself. Let moms and dads decide with the help of their practitioners if they need a certain medical treatment or dental treatment or not.
Hmm. Yeah, like show me you don't care by telling me you care. That kind of argument. Like,
Right,
so,
right.
um, I just want to circle back to the inflammation a bit because the fluoride is a hot topic, but I don't want to waste too much time on it. Inflammation, how does that connect to receding gums? I have several people talk to me about receding gums all the time, and I understand there's an aspect there of aging, but I don't take that as the be all and end all answer. I think there's more we could do to prevent receding gum line.
Absolutely. And it gets tricky with receding gums because sometimes it's caused by inflammation. Sometimes it's actually caused by improper bite forces, improper pressure on the teeth, causing the teeth to flex within the gums. And you really have to dig in to see what is the actual cause of that person's recession. It may not only be inflammation. But yeah, the mechanism is that if you have inflammation in the mouth and inflammation in the gum tissue, then your gums will kind of swell and get puffy, but they also, in doing so, will allow just this bacterial party to happen below the gum line. And that party of bacteria below the gum line is very destructive to the gum tissue below the surface, and it's destructive to the bone below that. And that's what really causes the loss of gum tissue over time and leads to progressing of gum disease is when you start to lose gum support, you start to lose bone support around teeth. And that's ultimately what causes gum disease to progress to the point where people are losing teeth down the road.
Where does malnutrition fall into that? Not in the aspect of malnutrition could exacerbate inflammation, but in the aspect of not giving the cells, the tissues, the mitochondria what they need to stay healthy and strong and present where they should be.
Yeah, that's a good point. So I think we all, to some extent, I think, lack a lot of micronutrients. And so things like vitamin C, making sure that we have a varied diet, tons of antioxidants are all important to making sure that the gum tissue has what it needs from internal.
Mhm. What about the nutrients required for the tooth, for the enamel, for the actual structure of the? One thing I will always say to my clients is you have to prioritize protein and minerals. Protein in regards to all the amino acids and minerals. Like if the because people get so caught up on calcium all the time. Like no, you need all of the minerals and all of the amino acids.
Totally agree. And I would add to that healthy fats. So that's really when I'm talking to patients about reducing their risk of tooth decay. It's all about making sure you're getting plenty of protein and plenty of healthy fats and minerals, like you said, because the fat soluble vitamins are the ones that your teeth need the most. So vitamins A, vitamins D, vitamin K, these are the ones that are so, so vitally important to making sure that the dentin, the enamel, that all of the hard structure is super healthy. And so we do, like I like for my patients to have lots of avocados and olives and lots of healthy plant and animal based fats.
Dark chocolate, lots and lots of dark chocolate, everyone. Like
Absolutely.
the good stuff, though, not the cheap dark chocolate, the
The
good.
good stuff. The good stuff.
So, how this is kind of a multi-level question, but I'm going to go for it.
Go for it.
A lot of, as we were mentioning before we even started recording, the people we work with, our own experiences are more so in that kind of midlife perimenopause age. And we know as we transition, and with the way we live nowadays, there's a lot of hormonal changes happening. How does that influence oral health on every level in regards to the hormones, but not just the sex hormones like the corticosteroids, the adrenaline, even the thyroid hormone, insulin? Like, how do all the changes that women and men experience as they get older influence the oral health? Like, it would be my understanding there would have to be some sort of influence.
Absolutely. Absolutely. So when we talk about estrogen decreasing, just like we see dryness in other parts of our body with a decrease in estrogen, we'll also see more dryness in our mouth as well. And anytime you have dryness in the mouth, you're going to shift that microbiome and things get out of balance. The saliva becomes more acidic and you'll have a much higher tendency towards these chronic illnesses like tooth decay and gum disease just from the estrogen itself. But then progesterone, as that starts to decline, we start to see more inflammation in the gum tissue and imbalance in this salivary bacteria that's present. And then obviously cortisol is huge in all of this. Our stress hormone really tends to go, and say this from experience. Cortisol kind of goes wacky starting in mid 40s. I don't know what happened. I didn't tell it to go wacky. Uh, but you will absolutely notice wherever your body tends to get inflamed, whether it's your gut or you get headaches or your skin, or if it's your gum tissue, then cortisol that's not staying in check will absolutely cause inflammation in wherever your weak link is.
And cortisol and adrenaline, they're going to stimulate ACTH, adrenocorticotropin hormone, which in like simpler terms causes leaching of calcium from the bones. But surely that might have some influence on the teeth.
Yeah, it's for sure not helpful.
Yeah.
And we will see an increase in tooth decay sometimes in midlife. Everybody's so different and it's so multifactorial. It's hard to pinpoint, okay, what's the cause? Because there's almost never just one cause.
Mm.
Um, but yes, absolutely, we will see more of a tendency for decay in different areas in people who weren't prone to decay before.
One thing that I recommend to my perimenopause and ladies mid-30s and onwards who start experiencing vaginal dryness more so because of like the increase in adrenaline, reduction in progesterone, like it's more of a stress response. One thing I use a lot with them to help protect the tissue and regression, and obviously as well the bacteria aspect, is coconut oil, like a really good organic coconut oil, very, very effective. And it also does have some steroidal hormone structures in it. So it can be super beneficial and like very gentle. Like douching and stuff, I'm like, don't put apple cider vinegar down there. That's a terrible idea. Coconut oil is a lot safer. But then, as you were saying, like, the oral tissue is pretty much the same tissue as the vaginal tissue. When that gets dry, one thing is pretty popular is coconut oil pulling, which that's where I'm like trying to connect. Hey, I kind of do that in the vagina as well.
Don't use the same coconut oil.
Yeah, or the same finger. But because someone's gonna ask, what do you think about coconut oil pulling? I personally don't do it because it's a pain. It gets all sticky. I just use a really good tea tree oil mouthwash. But I know a lot of people do use coconut oil. It's just so messy and everything.
Agree. I don't personally do it because I'm too impatient. But I will say my patients who have a coconut oil pulling practice and they do it consistently, and I'm talking, 15 to 20 minutes a day. Make sure you spit it in the trash can when you're done. Don't spit it in the sink. But I do see a reduction in plaque levels. I see healthier gum tissue. So I am all for it if you have the patience to do it and you're going to do it consistently. I have other methods. I've got other tools in my toolbox, so don't feel like you have to. But it's very, very helpful. It's unfortunate there's not a ton of peer-reviewed research on it yet, but anecdotally, I see very good results with it. Um, Typically, the only research that we see so far is with the traditional Ayurvedic practice of oil pulling with sesame oil. And I don't know of anybody, at least not in my practice, who's doing that willingly because it tastes pretty gross,
Yeah.
in my
And
opinion.
if I had 15 to 20 minutes to spare to oil pull, that's not what I would be doing. So I was just gonna stick with my, like I said, I have a good tea tree oil mouthwash and I got a really good fluoride-free toothbrush or toothpaste, bamboo toothbrush, the whole shebang. But the
As
oil pulling,
simple as salt water. Like it doesn't have to be complicated. You don't have to make oral health overly complex. Now I can get complex and I can get nerdy when I'm really trying to strategize and strategically knock down certain bacteria, increase others. But just for the vast majority of people, something as simple as rinsing with salt water. If you have a high rate of cavities, you can add a little baking soda to your rinse. Um, Toothbrushing, you can toothbrush with coconut oil, you can toothbrush with nothing if you want. Again, we have fancier tools, we've got better ingredients, but you don't have to get fancy, especially if things are already pretty healthy.
What do you think of oral probiotics? It's my understanding now that they do come in lozenge form as well. So we seem to be getting more advanced in the area of controlling the bacteria in that aspect.
Yes, I use them a lot in my practice. Um, Mostly because like I think they are helpful for just almost anybody. But when I'm really digging into a patient and trying to shift their microbiome, then I'll a lot of times take them through a protocol where I have them on some kind of antimicrobial rinse where I want to knock stuff out. I want to kill a bunch of bacteria. But if I'm going to kill a bunch of bacteria, then I'm going to follow that with an oral probiotic for a period of time. So we can strategically add back some of the good bacteria that we want to see. And you're right, it's not the same as the capsules that you would take for gut health. It's going to be in tablet or lozenge form so that it's dissolving in the mouth and you're getting the benefits of those bacteria before swallowing them.
So here's my question with that is part of the argument with the oral probiotics is that we can't guarantee where they're going to go. We cannot, even if they do get digested and eventually hit the small intestine and maybe some in the large, then we don't 100% know which team they're going to bat for. Like, are they going to decide to go on the good team or the bad team? Because we know bacteria can be manipulated and altered really easy. Like you take probiotics and eat Wendy's and a Coke at the same time, chances are that probiotic is going to go with the bad team because they're going to be dominant under that circumstance. Like there's no guarantee, is what I'm saying. So I'm not a huge fan of probiotics in that sense because you can't guarantee. And I don't want to be wasting people's money, so I'd rather take a nutritional approach with it. But maybe there is a consideration that if someone has needs a bit of probiotic support for their gut, maybe we don't do an oral capsule. Maybe we do an oral probiotic in the form of a lozenge or a tablet because it's going to go systemic. It is going to go down through the whole gastrointestinal tract. Like I would assume there would be a direct influence there, and maybe that is a better approach than taking the capsules and potentially wasting money.
Well, that's a good point. And you're right. There's no way to guarantee that it's going exactly where you want it to go. And even, for a long time, it was hard to know if the manufacturers were manufacturing it correctly to where there was even any live bacteria left by the time it got to your stomach. So yes, all of those things I think should be taken into consideration. And and you're right, like diet is such a huge part of that. And we don't want to be wasting the good bugs by putting them in a bad environment. So so my thought is that it's probably true for both. You don't want to be if you're using Listerine every day and brushing with, Crest or Colgate and snacking on snacks every day, is an oral probiotic going to do you a lot of good? Maybe not.
Mhm.
Maybe not. So I think that's a great point that you got to take a whole person approach.
Yeah, and I think the financial consideration is important for a lot of people, especially with inflation now, and we're being told to get all the other supplements. Like, oh, this is one more thing. I wonder, I might see what sources I can get here for oral probiotics. I don't know if you can get them on prescription. Well, in the city I'm in, there's 100,000 people and one biological dentist. So he's doing pretty well for himself.
I bet. Yeah.
But maybe I'll reach out to him and see what he has to say.
There
But
you go.
uh, so I wonder, do you know, this is just a random thought. do Amazon sell probiotics, like oral probiotics, lozenges? Are there any like common off the shelf ones that people can buy?
Eh, There are, I'm not sure if they're sold on Am. I'm sure there are some sold on Amazon. I'm trying to think if the ones I specifically use are sold on Amazon. If they're not, I know that they're available online. You don't have to go through a dentist to get them. So if you want, I can send, if you wanted to put a link up, I can send links to the ones that I use in my practice the most.
Yeah.
And if it's something that's available in Canada, then yeah.
Yeah. Most stuff in the States we can get up here. We're not total
Yeah.
hillbillies.
Right. Yeah, you're not that far.
So, one thing I've noticed, and I recommend to pretty much all of my clients, an apple a day keeps the doctor, the dentist, the cardiologist, the gynecologist, the whole lot of them away. But I personally have noticed that my oral health is so much better when I have an apple. It's like the apple cleans my teeth. I can like feel it scrape the bacteria and the plaque. Is that something that well, obviously you're smiling and nodding, so yeah, it's something that you recommend too.
And it's a real deal. Yeah. And apples have a ton of sugar. They're super sweet. And so if you were to eat an apple just by itself, is that my favorite thing? If you're cavity prone? No. But if like taking the actual nutrients within an apple, but having it as the whole fruit. You're right. When you combine it with the fiber and the peel, uh, the whole food is going to be far less damaging and far less of a negative impact than, say, the juice or applesauce or pureed apple or smoothied apple or anything like that. So the whole food is going to be much, much more beneficial. But you can bump that up even more. And this is what I tell parents of kids that are having trouble with snacks during the day is even when you snack, that you want it to be relatively balanced in terms of macronutrients. So if you're going to have an apple, then you can make it a far more balanced situation for your oral pH, for your oral microbiome. If you combine it with either peanut butter or some kind of, sunflower butter or cheese, if you're able to do dairy, just combining the sugar and the carbs in the apple with healthy protein and healthy fat makes it almost zero negative impact on your oral health compared to the apple by itself.
A lot of my clients will do Ceylon cinnamon on their apples, so we're getting a double whammy there of the polyphenols as well.
Yes. Oh, that sounds really good. That makes me
But it
hungry.
has to be the Ceylon cinnamon. So, I heard you mention in another conversation you had one of the few practitioners that I know that understands mouth breathing or lack thereof. And it's in my like I have an online group and they do a guide and there's a whole section dedicated to the importance of nasal breathing for the nitric oxide, the bacteria, blah blah blah, the whole lot. And then when I heard you mention it, I'm like, we have to bring this up. I'm a huge advocate of mouth tape. I've been using it for years myself. I really found an improvement in my sinuses with it. So
Yes. Yeah, it's so, so important. Your mouths are not meant to be the primary entrance to your respiratory system. They're meant to be the backup system. You are meant to breathe through your nose so that you can filter the air better, so that you can get more nitric oxide production in the nasal sinuses. So, really, if you're using your mouth primarily to breathe, or if you're just congested enough or have just enough of the habit that you're breathing through your mouth at night, then again, we start to see all of those problems that happen with dry mouth. Even if it's just at night, you're going to have a much, much higher level of acid in the saliva as that pH declines. You're going to have a shift of your salivary microbiome in a negative direction. and you will be much more likely to have plaque buildup and tooth decay and gum inflammation and the whole lot of it. So it's I have patients who will go through, we have an accelerator program in the practice. So anybody who's dealing with one of these chronic oral health issues, we see them more frequently. It's more like a functional medicine focus where we test and we make sure that they're getting better. And the patients who go through that program who are not able to get well, to really shift things right away, it is almost always because there is some underlying mouth breathing going on. It is the hardest thing to tackle, and you can do everything else right. You can have your diet right, you can be brushing and flossing and all the things. But if you are breathing through your mouth primarily at night, then it is so incredibly hard to prevent some of these oral illnesses. So it's definitely something that, you're right. I love mouth taping. I will send patients through myofunctional therapy, and we want to see if we can get to the bottom of that if at all possible.
Mhm. I find that with mouth taping, a lot of people are open to it. Men are more reluctant, and I roll my eyes because I'm like, oh, sometimes they're just big babies. They're like, just do it for God's sake. But there's an aspect of it can be uncomfortable if you're so used to breathing through your mouth all the time to switch that. It is a training in itself. You have to train yourself how to do it, so it can be uncomfortable. And then it has to become habit formation. Like it has to be part of your evening routine. For example, like my mouth tape goes on before I lie down and then I do my prayers. Like it has to be part of your habits.
Yeah,
But even
absolutely.
if it comes off during the night, once in a while it'll come off for whatever reason. And the congestion the next morning is like real, it's prominent. You can notice it. And people, I think, forget that if you're a mouth breather at night, I think a lot of people think it's not a big deal, it's only for an hour or something. And I mean that in the sense of a lot of people don't realize you're hopefully sleeping for an average of 8 hours with your mouth open. There could be anything going into that mouth that you don't know, spiders, the whole lot. That's 8 hours. It's not an hour. It's just like there's even thinking of that, there's a lot that can happen in 8 hours.
Yes, for sure. For sure. And now I'm going to be worried about spiders when I sleep tonight.
We've got to get some mouse safe, obviously. You gotta practice what you preach.
Right. No, I love that. And I usually will tell patients, especially if they're a little bit reluctant, to start in the daytime first. They make some spec. You don't have to be fancy. You could just use medical tape. But if you want to be fancy, they make some mouth tape that leaves a little hole in the middle. So I think that maybe feels a little bit less cumbersome, a little less claustrophobic if you're worried about it in the beginning. But I would see, can you tolerate breathing through your nose with your mouth taped for 5 minutes during the day when you're awake? If you can, then I think it's safe to try mouth taping. For some people, they really can't breathe through their nose. And then we've got to address things anatomically first or address some of the allergies first before we can even get there. But I would say, as long as there's not an anatomical issue, then almost everybody can do it. And even my hygienist had her 5-year-old mouth taping it willingly. I'm like, oh, I wish I would have known that when my kids were 5 and a little chatty. But
I
no, I'm
have
kidding. I'm kidding. Don't
Yeah,
tell.
I have one kid who you have to drag conversation of him, and another kid who won't shut up. Wow. So we're coming up on time, and I had a few more questions, but I'm just going to pick like the ones that I feel are most relevant to the audience. And that's kind of sticking on what we're talking about right now. Obviously, well, not obviously, for those of you that don't know, mouth tape can help with the snoring, sleep apnea aspect, but may require you to get a little bit uncomfortable in the beginning and then you train your body to improve that. Men, you can use mouth tape with a beard. It does still work. It's just you need to find the right one for you. Um, but this one is more along the lines of, if you wouldn't mind just touching a bit onto the aspect of TMJ and teeth grinding, because it's something I see a lot of women especially start to develop in perimenopause, because again the corticosteroids are going through the roof and the progesterone's going down, and when that adrenaline peaks at night, women are like grinding their teeth and they wake up and their face is sore and whatnot.
Yeah, and these cases get really fun because they're more complex and it takes a team effort sometimes because it's like this chicken and egg conversation because sometimes we talked about all of these airway issues. Grinding and clenching can be a key sign of sleep apnea or sleep disordered breathing. And so we absolutely want to be checking for that. We want to be looking to see if there's an airway issue that's contributing to the grinding or clenching. With the TMJ, same thing as hormones change and your inflammatory response changes, pressure and tension that maybe didn't used to bother you suddenly in perimenopause, now it's becoming inflamed and your jaw is sore. Either the muscles or the ligaments around the joint become sore and inflamed. And so sometimes it's primarily hormones, and it's best to treat the hormones first. And sometimes it's primarily airway, and it's best to treat the airway first. So I think it's really important that you've got a good team that you're working with, somebody that's helping you, a biological dentist who understands airway, and somebody who's helping you with your hormones and is able to know, when to pass the football back to the other person.
Yeah, it's all the things for sure. I think if we were to recommend the lowest hanging fruit and you hadn't tried mouth tape, then that's going like you can get mouth tape on
Oh,
Amazon for like
so easy.
$11, or you could just use tape.
Yeah.
So try that first, and maybe that will be it. Maybe that'll be the answer. And then if
Mhm.
not, then the hormones is next, because if you can't get help with hormones in Canada specifically, then you're going to have to pay out of pocket. So it's a bit more expensive. So I tried the lower hanging fruit first. I have had clients massage bioidentical progesterone around their jaw joint and behind their ears. And some people find it very beneficial, and some people need so much progesterone that you just can't, it's very hard to get it in that cream aspect. So,
Yeah, yeah. No, that
but
makes sense.
would you like to leave us with any words of wisdom around oral health? This has been great.
I would love to. Gosh, we went by so fast that hour.
And I didn't even
Um,
get everything in.
I, we'll just have to do it again. We'll come back and do it again. I would say just value your mouth. It is part of your health overall. Oral health is health. And secondly, I would say that your bodies are designed to heal. So whatever your illness may be, whatever the imbalance may be, you are designed to heal and be well. And so I think having just a mindset of gratitude and knowing that our bodies can do amazing things is the first step in being healthy and well.
Think we covered a lot in this podcast. Like, I really enjoyed it, but I think the one thing that stands out to me most is that if we could use the oral probiotics to optimize overall health, like that is genius. Anyway, we will have to have you back on because there's so many more questions, and I'm sure
We'll
people
do
will
it.
have them. So, where can we send people to find out more about you? Your Instagram is doing pretty well.
Yeah, Instagram is probably where we're the busiest on social media. So that's just at Dr. Toni Engram on Instagram. You can see our website at www.flourish.dental. And we're in Dallas, Texas, but we are happy to have people fly in to visit us for a little bit. We've got a lot of patients that they'll have their normal dentist at home and then they'll come in for a week or so and get dental work done with us. And then we send you on back when you're ready. So happy to have patients visit us, but we do have a lot of content online as well. So happy to have anybody access our content or our online courses online.
Yeah, there's a lot of Canadians who travel to the States for all sorts of health help, not just dentistry,
Yeah,
but also
yeah.
I'll get those links off you as well for the oral probiotics, and I'll share all of that in the description. Well, thank you, Dr. Tony. This was awesome.
You bet. Thank you so much. It was great to meet you.
And you have a good day.
All right, you too.